A very good evening to you. Thank you for joining us in UBC TV and for keeping it here with us. It's You Health Chat, proudly sponsored by National Medical Stores. Now, I know you're always curious to know what we have for you. Today, we take a little twist of events. Mental health is one thing that's going on the high, and there are very many causes behind it. Sometimes it might not be the cause, but this is one issue that many of you have been asking us to talk about, and that is none other than drug and substance abuse. So I have an expert with me who is going to help us to tell us how she's doing it, because she's been into it for 6 years, has been creating awareness, and especially amongst the adolescents, the youth, those who are greatly affected. That is none other than Ssebunya, who is the founder of Drugs Hapana. Anne, a very good evening to you.
Good evening, Sophie.
Thank you for making time to come through.
Thank you for having me.
Okay. Now, I guess when you hear the name, you're like, okay, is this the person we know? Well, she is a co-presenter on CBS FM, The Breakfast Show, with Patrick Omojoka. But of her free time, she has picked a passion, and this is something that she does after she's done with her breakfast show. She has been able to change lots of lives. I don't want to blow the trumpet for her, but let me just start by asking Anne the first question. Where did you draw from the inspiration to say that for you, your catch area and area of focus is going to be, you know, creating awareness about drugs and substance abuse?
And substance abuse. So 7 years ago, I went to some schools deep down in Masaka. We had gone for career guidance. You know, I used to do career guidance. We get there at noon, and most of the young people are out. At noon, they are out. And I'm asking, where are these young people? Where have they gone? And they tell us, okay, they are down, you can take down in a shamba. We went to a certain land, and we get to know they are using Mairunji. Some are helping out with some of that substance, they are helping out. Others are even using. That means they can't even have afternoon classes. So we started talking to them, why is this happening? Sometimes they are telling us it's okay to use. They are telling us when you go to school using this, you're going to be more smart. You're going to be the first one in class. You're going to be... So they had so many myths surrounding this. So that's where I derived. But I'd also had some person in family way back, someone who was struggling with alcohol. So that's when I got in touch with Butabika Referral Hospital. I went there, talked to Dr. Basangwa. He's been my teacher for 7 years now. They've been really doing a good job with Drugs Hapana, and that's the genesis of Drugs Hapana initiative. And we registered in 2017, and we started mainly, it's an awareness, education, and prevention initiative, basically focused on fighting the experimenting and use of drugs and substance abuse among young people in Uganda.
Okay. Yes. Now, when you talk about it, how do you... what are your research findings so far? Because I believe now you're so deep engraved. What percentage of the young people, can you say, have you found out are into drug and substance abuse? Right
now, especially after COVID, when we go to schools, we discovered recently, before we thought, okay, it is happening. We had a lot of young people involved, and the figures, they are like, you know what, 40 different rehabilitation centers had different figures. Then came after COVID. That's where we are having a problem, mainly because we are dealing with the schools. So we go to schools and they are telling us, you know what, at the beginning of the term, we expelled 20. Yes, they were smuggling in drugs. And another school tells you, okay, the other time we are able to get a gang of boys, 30. So that is especially after COVID. That's where we're having the problem. Most of them, I think they went through a lot during COVID, and they started using. Even those who are not using, they started using. So those are some of the figures we're struggling out. Of course, other schools, they don't want to talk about it. We stay with these figures between us and the schools, because they don't want to scare the public. When you talk about it, people will be like, I can't take someone to that school. So yeah, so far that's what they're struggling with.
Now, from after COVID, of course, I think a lot happened around that time. Kids got a little bit unruly. Have you come across some of the cases where some of them will even develop mental health related issues due to substance abuse?
Yes, many. Some are losing it. If you go to Butabika right now, the numbers are really overwhelming, overwhelming. And most of them are very young, very, very young people. These are young ones. And you start talking to them. Yes, even at work, while I'm at work, they normally come, the parents come. And you're doing this awareness, you're doing this, please help me, which rehabilitation center do I take this one? They've expelled her from school, they've expelled him from school. What do I do? Where do we start? So because we are referral, Drugs Hapana is a referral of most of these rehabilitation centers. So we tell them, you know, this one is better for this one. You can take this one to Serenity. You can take this one to Hope and Beyond. That's what we've been doing. And we talk to them and they admit them. So most of them, you come and they tell you that, you know what is happening? I'm being molested at home. That's why I'm using. You know why this is happening? My peers, my friends told me to use this. You know why this is happening? I had a problem. And I tried to talk to my mom about it. She didn't give me time. They don't have time. Most of the parents are very busy. So even in schools, we've discovered there is a big gap that is happening right now between the parents. They are hustling to get some money, and then they forget there's something they should do with these kids. They should give some time to the young people. Then the young people are like, where do I find the answers? Okay? My friends are telling me, if you use this, all your problems will go away. No, if you use this, you're going to be smarter in class. So that's where the myths are happening. They go on, the misconceptions, they go on. That's where the numbers go increasing. But luckily, when you go to these young people, they are willing to learn. You talk to them and they are so willing to learn. They ask questions. But why are you telling us we should stay off these? My friend told me if I use this, I'm going to be the first in class. Luckily, we are going with recovered addicts. My team, Drugs Hapana, has a team of recovered addicts. They go and they share the stories. They tell them what they've gone through. If you see most of the outreaches we've been to, we go with the permission of the doctors and they say, okay, we've been treating him or we've been treating her. It's okay, you can go with her right now. And they share the stories, like the doctors with the projectors. We tell them this is what is happening. It is you to decide. Are you for this? Are you for that? Then he looks at the photo and he's like, so that's how you looked while you're using. And now this is how you're looking after recovery. And someone is like, okay, more questions. Very interesting questions that come up. But the good thing and most lovely thing is the young people are eager to learn. But what kind of knowledge are we giving them? That's what we have to do more.
Now, as you're dealing with these young people, how do you select the schools in which you go? Do the schools invite you, having discovered that they practically have children within the societies that are using the drugs, or you just go and request for an invitation in a school and you just want to sensitize them?
The first years, we used to approach the schools. We used to go, please give us a chance to talk to them. So with time, it's now referral. The schools are referring us. You just sit, we are in office and the schools call us. Please, we need your team to come and talk to our young people. So this year we've been dealing with the S1s and S5s. Those ones were just, this is what we've been dealing with. We've had a number of outreaches in the first term. But then second term, because we are preparing to engage all student leaders across the country. And that comes because we are limited with resources. That's why we started such programs. We are going to engage the student leaders, because when you engage the student leaders, the secondary level, they will go back and communicate the same message. Remember, these are interacting with their fellow peers at a daily basis. So they go back, they pass on the message. This is what we had, this is what, because we realize in the school outreaches, they really associate a lot with the student leaders. Sometimes they're scared to go to the teachers. Sometimes they are scared to talk to us, to talk to the parents. So when they hear something from their own students, the head girl or the head boy telling them this is what is supposed to be done, then we also add on creating clubs in schools.
Okay.
Yes. So these clubs are like, they are creating Drugs Hapana club, and the major role for this club is basically to preach the gospel of drugs hapana. Stay off drugs and substance abuse. But how do you do that? How do you prevent yourself? How do you use your time? If you have a problem, who do you approach? And that's why we are urging more, we are asking schools, please, also to involve school counselors. Yes, sometimes they say they're having issues with costs, but I think we tell them, at least if someone is not staying at the school, you can bring in once in a week someone to listen to these young people. They have so much going on. And sometimes they are not even willing to, sometimes someone starts using without even thinking he's going to use. But just because, okay, I have an issue with her, I have an issue at home. We went to some school, I don't normally mention the schools. Went to some school and the kid was really, really worked up with the parent. Whenever she went back home, the parent was always telling her, you're nothing, go. I put in all this liquor, I put in all these drinks in the fridge you don't use. Why don't you take some? You and your mother.
Encouraging?
Yes, and the encouraging a form too. And she broke down. She broke down telling us, what do I do with such a parent? What do I do? He's always telling me that, you know what, we are not helping him, but he stocks the fridge like this with sockets.
Oh dear.
Yes,
That
the socket type.
Very dangerous.
And she's like, what do you expect me to do? He's always telling me, you're a failure. You're a failure. And she was breaking down. And she's like, now, when I come to school and I see the Askari having some, I wanted to ask him if I can use, such that I'm no longer a failure to my what?
To my parent.
My parent.
That's
very terrible stories, but that's it.
Now, for some of those, the parents who come and dump to you and tell you to take them in rehab, so whose responsibility is it? When you guide them, do you take them there yourselves?
Yes.
Do you also go an extra mile to try and counsel the parents after having discovered what the problem is?
Yes, there is a family intervention with the rehabilitation centers. So when a young person is admitted, of course the first sessions, you have to leave it with the doctors. The doctors to do their job. Sometimes it's hard with the parents. We tell them, you're not supposed to be always checking on this kid. The doctors are handling and the counselors. This person has been admitted. Please give them time to do their work. But when you give them time, sometimes like I said, someone's struggling. No, I have to check on my kid. Is he okay? Is he safe? Is he what? Things like that. But then our role, basically to talk to them, give the doctors time. So after the hospital, they will always invite the family for some interventions. Who is responsible for this kid? Why is this young person going through this? How do you help? When the time for treatment, when he's recovered, where is he going? Where is he going? Okay, is he going back to the same community? How are you going to help him not to go back? You really need also to empower the guardian who is responsible for this young person. If you don't, then that's where we end up with the relapsing, and they relapse. So we work with the doctors, and they normally have to have the family interventions. If you don't, sometimes it will be tricky. And now remember, this one has been talked to the young person after months, though it's a lot of sometimes even after a year, he's recovered. Then if you've not empowered the parent, then that's a big problem. Yeah, so true. For the referrals, most of the rehabilitation centers, that's normally part of the course, that is normally part of the treatment.
At what stage do you advise parents to take the children to the rehabilitation centers?
The parents come and they talk to us and they're like, he's been expelled. But sometimes, most of the times, the ones I've dealt with, they bring kids even already tied up, very aggressive. Oh, wow. Yes. And they can't handle. Some of them are also doing something, but they are doing some we normally call it self-medication. And the parents try to be the doctors. And they say, you know what, we want to calm her down. She's having an episode. What do we do? Okay. Can you go to the pharmacy and bring something? You just ask for something to calm her down. You don't know what you're administering. Maybe you're making some things worse. So sometimes they bring them when it is really when she's or he really is in a bad situation. So you call the doctor, they admit her. Most of the times they come when they've decided. And it's one of the good things about those young people. When someone is like, I've had it, now that is a good starting point. It is one of the best steps when someone says, you know what? I have had it. I need treatment. Of course, there are some who come in when they don't even want. What? In denial. You sure? No, I'm very okay. I don't have a problem. Even that happens. Then you look at of course, because through the work we've been, you can see the symptoms. You can see someone really wasted. And you ask, how long have you used? I've not used for so long. I've used for 4 years.
And that is not so long.
For him, he thinks that's not so long. The first, like, he's avoiding you, direct eye contact, he's like avoiding. No, I've not had. 4 years is big.
Even 1 year
Deadly,
alone.
that's already deadly. Your organs, you're struggling. There is so much toxins in your body. Yes, so then when you take them, of course, through the doctors will walk you through the steps. This is what is supposed to be done, this is what. And those ones we find in school. And the teachers call us, when the head teachers call us. You know what, Anne, we have a situation. 3 girls have been, or 3 boys. We got 3, but we're expelling them. We want you to work with the parents. How do they help them? Some maybe have just started. They need guidance, they need counseling, they need little treatment, and they will go. There's this detoxifying situation that they do, process, and they go, and everything. Normally it's better to talk to them. Maybe someone was just starting and is like, okay, how do I get back to the right path? And some really listen, and they never touch it again. They never even try at all. Because they say, like, I just used once. We found one student, he was even a prefect. The askari gave him. Oh no. Yes, now that was bad. So we normally tell the head teachers, please try your best. Even that askari, talk to him, find out, how is he doing?
How is he relating with the children?
Sometimes because they have their own things going on, and to them they are like, how do I make quick money? I need these blue sockets here. They bring in the sockets of the liquor. They're like, what? You have a party? Yeah, people need to get high. How do we do that? You don't worry, guys. You just give me money.
And that's done.
And that's done. Yes, so that's bad. So the more they have to, but that's why we are asking them that the more we go to these schools, that's all these stories I'm telling you, by the way, they are from those, from the outreaches we go and they tell us. Because one time a kid was like, excuse me, he was asking a doctor, now you're telling us that's what happens to the kidney, right? Okay. Now, if that's what happens to the kidney, how comes our askari doesn't have a problem with that?
They think they can see inside.
Now they were very free with us, because we normally tell the teachers, you can go either in the back, give us a free zone with these young people. So they didn't know that the deputy head teacher was behind here listening. The askari, they get to the askari's place.
He was well stocked.
Yes. They were having lots of parties. It was almost the 3rd term. They had some gigs, end of year parties, but the askari was the supply.
Oh dear.
The school askari was the supplier. And because after outreaches, we would talk, luckily the deputy teacher had heard. So even we involved the head teacher, we had a meeting, and it's like, this has been going on in my school for how long? You're like, this is really going on, but we need to help. So they intervened and everything went on.
Okay.
And they're counseling the young people. That's it.
Then in terms of the cases you have dealt with, sometimes you know why parents will possibly end up self-medicating is for the fear they think that when somebody is taken into rehab, they think the person is being classified as mentally ill, or if not so, they think the person is going to be sedated, where you hear them. There is one recently I had saying, omutwala butabika tomukiriza mulekayo bajjamu amalagala gamumalamu amaanyi. As in other words, they'll give the person the drugs to totally weaken them, and they'll always be like zonked up and they're all like weak and drained. How far true is that, Anne?
There is a lot of stigma surrounding rehabilitation centers.
Yes.
There's a lot. Like, of course, a lot of stigma when it comes to treating even the person who is already using the patients. Find out from an expert. Find out from a doctor. Most of us are so busy, we are like, I heard they talked about this butabika. I heard they talked about it in a Hapana Rehabilitation Center, Open Beyond Rehabilitation Center. Someone said when someone uses and goes to a rehabilitation center, it gets worse. Go and engage a doctor. Talk to that doctor. I have this problem. Take time off. I have this problem. But we've had parents who are like, Anne, I don't even have time, my dear. I have a flight. I'm so busy. Please handle those kids. They were expelled. You'll tell me your cost, the money, and I'll call you. I'm off. That is a parent. But this is your daughter. This is your son. Take time off the work. Engage a doctor. Doctor, we have this situation. What do we do with ABC? The doctor will be able to guide you. This is the step. Step 1, step 2, step 3. He doesn't need this. He needs this. We had a situation where a mom came so pissed. And she came and she made a scene at my workplace. She's like, this girl is using, she's closing. Because for her, she thought she was using. This is where the problem is, some parents. She's like, this girl is using. She's always closing herself in for 3 days. The girl was closing her room, in her bedroom. So we go, she called, we got time, we went to see the girl. And I talked to her, what is happening? She said, I am having a problem. Okay, it took time for her to open up. We went outside in their compound, but she took time to open up. And she's like, I have a wound and there is some blood coming out.
Oh.
And this girl was in P6. She was fasting, she was having her first period.
Oh.
And the maid, there was a lady who was helping the home. She just told her, use that cloth. So for her, she's like, if I tell mom, she'll think I started doing bad manners. And the only solution to use the cloth and always lock herself in the what? In the bedroom.
In the bedroom.
And the mom said she had when kids start locking themselves in the bedroom, they are using. So you have to take her to rehabilitation center. You see a lot of gaps there. And she gets to know, eventually I told her, she's not using. She has had her first period. And the mom just, like the tears were rolling down. What?
And the child could not talk to the parent about it.
Exactly. So you'll think, this is what they say about rehabilitation centers, you're thinking the kid is using, sometimes they're not even using. They have another problem. So you just engage the doctor. The doctor will be able to bring the kid, will be able to have an audience with the kid. And the kid can tell you, you know what is happening? You'll find out something the kid is not even very comfortable to talk to you about. But most of us, when we try self-medication, sometimes it makes it worse. And we are thinking, they told me when they start looking like that, someone is using. They told me when someone starts talking like that, my son, my daughter is using. You're just thinking and you're not getting time to have an audience with experts.
Yeah, true.
Yes, even us when we're starting, by the way, when we're starting this, even us, there are things we didn't know. I would go and talk to them. By then, we're still in the learning process. The doctors were teaching us. So sometimes I'd look at someone and say, like, I think that person is using. Until, and then I also thought, now I know, you can come and start saying, hey, that person is using, when someone is something else is disturbing
so you
that
need
person.
to first hear their story.
Yes, you get to know these people. Why is this person having? You need to understand them. If you hear their story, because you'll just say, we have to use this. Wait, you don't have to use that.
Yeah, true.
Yes. And most of us are in homes because we don't want, how will my friends hear that someone is using? You start administering funny drugs. Some, like we said, are in denial. You'll take the kid to the village. How will people hear that she's using? Some will say, my kids can never use drugs. That's witchcraft. This is happening.
Continues.
And they keep taking the person from one to the other shrine, to the other shrine, and the kid is getting worse. By the time they remember to bring that kid to a rehabilitation center, sometimes it's too late. And something happens and you're like, yes, that rehabilitation center did this to this kid. But because there is something you've been administering for so long, by the time you get here, it's almost too late.
Yeah, true. That's sad. Okay, at this particular point, Anne is saying it, and I think it is quite sad to see that sometimes the kids are getting into situations that they are getting into, not because it's their choice, but because of the absence of the parents. Most of the parents of this generation think that once you provide, you've given everything. The food is there at home, especially the fast foods are there, the sodas are there, everything is there. Then the children are sorted. And then also, remember now, the smartphones have also got a very big role to play.
Yes.
Let's take a very short break. When we do come back, me and Anne still have to take you through this discussion. She has a very wonderful initiative and has been able to save lots of young teenagers out there and adolescents.
Yankwenu nawe olowooza ababbi b'oku street be banzibye saabo kankubulire natikka ebintu byange okuva China ne baŋŋamba neetaaga tiini namba nze nga sigirina neetuma omuntu omulala abindeetere kati ngenze mu URA baŋŋambye ebintu byange ebiri mu manya gange era si byange mbu sayina tiini namba nze kati nebya tiini namba sibitegeera Amene mfudde obusete neewola bwewole ye tiini namba byebiki bannange sente zange
tax identification number oba giyite namba musuubuzi gyewandiisa muyiwala asasulira emisolo
kati ebyo nze njifuna ntya bambikola ntya
ebintu babigonza olina ndagamuntu
iyi njirina
ogenda bugenzi ku website ya URA www.ura.go.ug awo n'olondako e-services then n'ogenda ku tin registration awo n'oteeramu n'ennamba yo n'omwaka gwe wazaalibwamu amannya go gajja kwereeta automatically awo n'ojjuzaamu n'ebirala bitono nnyo ebyetaagisibwa ng'ennamba y'essimu yo email address yo ne gy'obeera era nga bino osobola n'obbisanga emabega wandagamuntu yo then n'osubmitinga nga kamesagi kajja direct ku ssimu yo mu ddakiika ntono nnyo
nga sina bannange bintu bikolera ddala bannaye obugayaavu kibi omanyi obugayaavu bukuza muti bannange weebale Dangote bannange omponyeza omanyi ebintu byange bingi byowonyeza okubbibwa nzizeyo mu URA mbalage nti njirina
Okubeera ne tin namba kikuyamba mu bintu bingi nnyo okugeza mu kusuubula n'okusuubuza eby'ebyamaguzi mu Uganda ne wabweru wa Uganda, okuddizibwa ensimbi okuva ku misolo gy'osasula, okufuna looni mu banka ez'enjawulo, okufuna layisinsi okuva mu government agencies zonna, okuwandiisa emmotoka yo n'okugula oba okutunda ettaka.
URA tukulaakulanyize wamu Uganda.
This isn't just a girl. She is the future. This is a teacher, a doctor, a community leader, our future president.
She is the future of Uganda. And as a policy maker, the policies I enact today will protect her from child marriage and teenage pregnancy. We each have a role to play in empowering our teenage girls to protect them from child marriage and teenage pregnancy. Because when we empower them, we empower our nation. Protect the girl, save the nation.
Take action. Report any case of defilement or child marriage to the police or call Sauti 116.
Where does it come from? That thing that makes us Ugandan. That thing that makes us different from everybody else. Where does it grow infinitely? Some say it's in our history, in our culture, and in our hearts, in our warm smiles and vast miles of coffee, dairy farmland, and amazing maize fields. It's in our inherent pursuit to always be better, to never stop growing and glowing. So you see, we are more than just a waving flag. We are a nation of sweat and skills, a nation of ideas and inventions. But what truly makes us Ugandan is our quest to improve the quality of life for Ugandans by creating sustainable jobs, businesses, and improving household incomes. That's what makes us Uganda Development Bank. Uganda Development Bank. Inspiring development.
Jerry con. Jerry con. Hey, Master Blaster. Touch him, man. Buy Jerry con with muscle. Those ones who say go is for you only. Mundava. Best movies I teach you. When I go to which the muscali, because of the cover is very far. Is you serious? Is serious you? What? Yeah? You step it on it. Add kilometers to your legs, and you get your sugar. We buy meat from Umaru, and Umaru refuses to give you enough meat. Show him that they don't joke with you.
Okukakaluka n'okulungi kwetaagako omuntu akuyambako, n'olwekyo tujja kukuteerawo embeera esaanidde osobole okukola ekisinga. Awamu teri kitulema.
It's still You Health Chat, and we are talking about drugs and substance abuse awareness. And this is being spearheaded by an initiative called Drugs Hapana that was founded by Ssebunya. And we're still talking about this. Now, luckily for those who schools accept and invite you to go there and have these talks. Now, for those who can't, who are maybe like saying schools where this might not happen, how do you convene, or how do you plan to convene them, especially the young children during the holidays, to preach to them this message?
Now, during the holidays, we are soon starting even the holiday engagements among the young people. But we started with schools. At first, we started with schools, and the public was like, you know what, you guys, you've started doing something good in schools. What about the other kids who are not in school? So we started, we even realized there's most of those young people in Katwe. We've been doing some research. We went and visited those ones in Katwe and Chisenyi down there. And there is a lot. And you're like, when you sit with them and you try to see how do we help them. But just because we are limited with resources, when some people come up, because I'm in media, some people come up and they're like, you know what, can you get me 2 people? Some people just come in and they offer, if you can get me 2 young people, I'll be able to pay for them at rehabilitation centers. you take those ones. You go to Chisenyi, you find those ones. Okay, I had this list. Some are like, now you get that one. So you're like, okay, this one needs help. So among the people who are offering, some organizations that come up, they can take them back. We're also trying to look for resources from different organizations to see how we help. Yes, we've helped, I think we've helped like 15 in us, but just through those ones, because you want to take these ones, we are taking them to vocational institutions. For someone to acquire skill.
Yeah, that's true.
That one acquires a skill and we're able to be able to make some money eventually. And that will keep him busy or her busy. So some are still in the vocation. When they get out, we'll be able, when they graduate, we'll be able to make noise about it. Those are our babies.
That's nice.
Yes, so through some support from different, outsourcing from different organizations and people who are willing to help.
Now, Anne, is this true or false? Because it's rumored that the children, especially who are greatly affected or who are more into using the drugs and these substances, are children from the high-end families, the A-class families. How far true is this? It is rumored.
Yes. Many are affected from high-end.
Why does it turn out that way?
They are really busy. I have so many parents from high-end, and normally someone, like I told you before, someone was telling me, and I'm traveling. She's been expelled from school because they found her with drugs. I don't know what kind of thing is that, drugs in my home. Okay, you deal with that, you call me. And like someone is serious, is leaving you.
With a child.
With a child, and she's going to the airport. That's a parent. So yes, many of them.
But I thought that since these high-end kids are provided with and given everything, you expect them to tread the smooth path.
And now that's what we think, parents, that money, giving in all these good things, expensive phones, the screens, the tabs, we think that is love. That is not love. I had a patient, someone who, a high-end person, who had a patient in some rehabilitation center. I happened to be part of their family intervention. And the dad was so pissed. Why are you wasting our time? Whenever I travel, I buy you all these iPhones, I buy you all these screens, I buy you all this. Why are you wasting our time? And he's like, yes. Whenever you give them to me, I take them down in Baise. They give me some money and I can buy a fix. I don't want those phones. And then he broke down. He's like, Dad, could you just give me at least 2 meals in a week? Let me just have a meal with you. Let me just have a lunch with you. Let me have just a breakfast with you. I want a father in you. I want my dad. What do you mean by that? I'm always working for, I want my dad.
Wow.
Just give me, let's just share a meal. I just want this boy. It was bad. And at first the dad could not get what the boy was saying. For him, he was like,
I'm busy.
I'm here. Your dad, I'm here. And he's like, please, Dad, I want you here. Let's just share a meal. Okay. What do you want? You want you to take you to where? Which meal? Jabba's, which hotel? Until the guy, it took the doctor some time. In fact, she's called a sister, one of the sisters in that rehabilitation center. It took her time to engage this man who was on his high horse, and he's like, now, you just start with small steps. We'll have time, you sit with him on breakfast. And the boy went on to elaborate. Do you ever know what I go through when I'm at school? Have you ever even asked me that what happens at school? You see, these are things we see, these are very simple things. For us, we take for granted. And the kids just want to know you care. For us, some of us think caring, I'll spoil them. Give them money. Let them. For us, that is that is what we think. Yet the kid is like, I wish I could get some attention from the parent. From the parent.
So that attention seeking leads to that.
And you're leaving a gap. So the kid starts thinking, okay, the parent is not around. So where do I start looking for someone who can give me attention? He ends up in the peers. The peers are saying, you know what? You know what the latest fix is? Hey, whatever you're having, whatever stress you want to take off your mind, I have the latest fix. What kind of? Oh, he goes on the screens. You're giving him the phones.
The phones.
He will just say how to deal with stress. Do drugs help with stress?
Sorted.
Yeah, sorted.
Now, and I know you're having what you're calling the second national conference for prefects. What exactly is this, and give us a little bit of detail about it.
So when we realized that we can't just, we can't reach all schools because of, like I told you, the limited resources, that's when we came up with one of the programs. In Drugs Hapana, we have different programs. We have school and community outreaches, we have skilling programs, then we have advocacy programs. Among those, we created the parental model program. So then we also, among the school outreaches, that's why we derived the second National Prefects Conference. We had one in 2019. It was overwhelming, the first one, quite overwhelming at Hotel Africana. And the submissions from these prefects, we give them some time to submit. They had so amazing submissions. We told them, we need you to also add a voice on this. We are not going to sit back in our boardrooms. We are not going to sit in our offices and decide for you. There are things you know more about this than even us, but we want you to add the voice. So they were giving us in 2019, that's why we decided to go on with it. They were like, you know what? You parents, you guardians, you're smart, but we are smarter. These are solutions we want you guys to check us even more when we are entering schools. That is when the prefects were telling us how young people are smuggling in drugs.
Oh dear.
That someone can use even a calculator. A kid was demonstrating on that conference in 2019, a calculator. There is somewhere, she opened a calculator and she's like, you see here? And she was like, do you see these ones that we normally call brain boosters? You see bread, sugar, oh God, we got cookies. They told us a lot, that's why we're involving them. And they're like, even the doctors that normally are part of the conference, what they teach them, they're like, okay, we got to know this. They go back and teach the young people. So 2019 we had one very successful. We had there were 78 schools that attended Hotel Africana, and then COVID came in. Last year we tried. We were preparing for one. Ebola came in. We pray this time we can. We are resuming with the second one. So we would like, of course, to thank the Butabika National Referral Hospital. They've been they've really helped a lot. Our bosses at CBS FM, they've helped a lot. And we are trying to make sure that this goes on like that, because when the young people get to know, they'll go back and spread the message. By the way, some schools, we had a specific number at first. We used to tell them each school should bring 15 prefects. But then we realized some are like, nope, I'm bringing 30. I want all my prefects to get to learn about this, and they
come and preach the gospel,
in school. And we got some good results, by the way, after the 2019. We have ambassadors, we have volunteers who are spreading. People, like some of these young people are so passionate about this. And some are studying. We have one who told us he's in Chambogo. He went for, he told us, you know what, I decided I'm going to study more about mental health. So those are some of the reasons, but we want to push it further and try even regionals. This is the one is happening at Hotel Africana on 22nd June. The more, then we can try to see whether we can push with the regionals, Masaka, Jinja, Mbara. It will depend on the partners that are coming on board.
I have a quarrel with you.
Yes.
2nd June kids will be in school. Why didn't you target the holiday season?
22nd June.
Will they be in holiday?
Yes, yes, you're right. No, why we target, they will be back to school.
They'll be back to school.
Yes, why we target that? Most of the schools, secondary schools, by 22nd June, they've just elected the new prefectorate body.
Okay.
Yes. So we wanted to first empower these ones. We are also going to do another one for parents, by the way.
That would be
We need to do one for parents. We are bringing one for parents because there is so much. And the doctors, all these doctors who are going to be part of this, they're willing to share. We have a number of them. Dr. Basangwa, he's the former executive director of Butavika Hospital.
Yes.
Among the teachers who are going to teach these ones, we also have Dr. Brian Mutamba. He's the deputy director of Butavika Hospital right now. We have the SSP, the chief political commissar. ASP Hadija Namtabi, she's going to talk about the law when it comes to the law. Then we also have the acting commissioner for mental health, Dr. Afsa, Minister of Health, Rukwata, she's also going to be. We have Haj Abem Chivi, he's going to talk about talent and fame against drugs and substance abuse. We have Dr. Kalema David, he's also going to talk about symptoms and addictions. Simon Senkai, Mr. Simon Senkai is also going to be part of it to talk to these young people about living purposefully. Then also Mr. Bill Benkunda. He has a very amazing recovery story. He started in school, where it was in Chisubi, SMAC, that's what he said. That he used that and how he ended up getting, he has a very interesting story, especially when he talks to the young people. Then you also have an artist who is coming in to talk about music against drugs. You can make it in any field. Many like making it in music, but she's going to tell them how you can make it music against drugs, music against drug abuse. So it's a lineup. We have even someone from Minister of Education, Mr. Saidi. He's also going to talk about mental health. We are bringing on board different partners, but all we want to empower these young people to know. While we are doing this, you say this is the camera. I want to talk to the parents. Please, however busy you are, find some time. It doesn't cost you to find a little time and talk to this young man, this young girl, these kids. Talk to them, find out what challenges are they going through. Sometimes there are some topics that some parents will find hard to talk about, and you're like, how do I address that? There are counselors, professional counselors, where you can take this kid and they'll be able to talk to the what? To the young person. The kid will be able to open up. This is happening. Other than you finding out when it's very late, please take time to talk to these young people. These are your kids. Yes, you're hustling, the economy. Some of them normally tell us, economy is coming. I don't know what to do. Economy is, I understand. But please spare some time for this young person. If you find most of the people, older people, when they are talking, they say, my mom told me this, my dad told me this. The kid will take your word as the gospel truth, by the way. Normally that's what happens. Please take some time and talk to them.
Okay. Anne has summed it up very well for you. I know this is a topic that if we chose to get into it, a lot will be discovered there. Some of you are asking yourself, how comes my friends' children have ended up in Butavika? Right under their nose, this has been happening, and most of the parents never get to know. Trust me, listen out for when these conferences are going to happen. Encourage the schools where your children are going to invite this initiative, and children are talked to. But most importantly, parents find time for the children off your busy schedules. We know things are not easy out there as you're looking for funds here and there, but find time for them. Well, that is all we had time for tonight. Catch you next week, same time, as we wait for Lauren Kazimoto to come your way at 10 o'clock with the news. Good night from me and from Anne.
UBC.